So what are the symptoms of prolapse? Typically the patient complains of something coming out from below, or what we in medical terms call as per vaginum. It can be at any point of time during the day, or it can typically start off with something coming out when she's passing motions, when she strains to pass motions or strains to pass urine, or when she coughs. Sometimes when the prolapse is prolonged and extensive, what happens is that the vagina or the uterus along with that starts pulling in the front the bladder, and behind the rectum and the anus, the bowel, the lowermost part of the bowel, down along with that, because of which they can develop various symptoms related to these organs. For example, they may complain of having to pass urine more and more frequently and in small quantities. Sometimes because the urine collects in that pouch which is formed, they may get repeated urinary infections and symptoms of repeated urinary infections. And sometimes because the pouch has formed which collects the urine may not be completely passed out, and this may result in symptoms of urinary obstruction or feeling of incomplete evacuation or voiding of the urine. Similarly, when it comes to the bowel symptoms, they may complain of worsening constipation and feeling that they have passed motions but they are not able to pass it completely. Still a lot of it that they keep on feeling that heaviness lower down. And other thing sometimes they tell is that when they put the finger inside to reduce that prolapse or reduce that organ which is coming out, they can evacuate the remaining part of the urine or the remaining part of the stools. These are the common symptoms of prolapse. Other things that because of chronic prolonged exposure of the vagina or the mouth of the uterus outside to the external environment, they may develop ulcers on that area and repeated and prolonged infections of that area.